Scotland have pleaded with the public to stick to the coronavirus regulations amid a surge in the number of cases. The Royal Alexandra Hospital in Paisley has even resorted to colour-coding areas based on the risk level of catching COVID. Despite a feeling of camaraderie among the staff, one doctor says it's still affecting their well-being. Meanwhile, the Prime Minister has claimed NHS staff have been looked after by the government.
We do our absolute utmost to support our wonderful NHS staff and have indeed had a 3-year pay package for nurses that I think was 12.8%, and will continue to invest record sums in the NHS. I think the amount we invested in the NHS even before the pandemic began was more than any time in modern memory, £34 billion package of investment, and that will continue under this government.
But the 12.8% figure mentioned by the Prime Minister only applies to newly qualified nurses. In Scotland, NHS staff are to be awarded a £500 bonus due to the pandemic, and that's as ministers in Northern Ireland have also said they will pay medical staff the same amount to acknowledge their hard work. They will also pay a lump sum of £2,000 to students who've been working in hospital settings between last October and this March. So, just how much of a toll is the pandemic taking on medical staff? Well, I'm now joined by nurse Matt Tacey. Matt, thank you for talking to us. What have you witnessed?
Thank you very much for having me. So I work in the community. I don't work directly on COVID boards, but I can speak from experience that I've witnessed both the physical impact of COVID, but also the mental health, the impact COVID has had on mental health. I do know a nurse that before she developed COVID, all she took was ibuprofen and paracetamol. Now she's on 10 tablets a day, 3 inhalers, and developed further complications following COVID. In terms of the mental health, it breaks my heart seeing our colleagues on their knees. It's terrifying. We've got staff, as I speak to you now, on the wards experiencing PTSD, and that petrifies me. So unless something is done now and immediate, the plans need to be long-term as well. I really, really, really worry about the long-term effects, both on the physical but on mental health of NHS staff.
Well, are there any procedures in place to help staff overcome what they've experienced, both physical and mental?
If they are, then I'm certainly not aware of any. I don't know of any. That there's the problem is we need to have plans that are going to fix the problem. We don't want plans that are put into place just to look good on a piece of paper. We want support that's going to address the real issues. And I fear that sometimes it's a bit of a knee-jerk reaction. Oh, look, we're offering this looks good on a piece of paper. Is it addressing the issues? Is it going to solve PTSD for the next few years? I very much doubt it.
But then, on a practical level, what needs to be in place to help medics working on the front line?
First of all, a competent government. A government that listened to scientific evidence. A government that listened to the professionals. We've been screaming out, for the last few months saying we're on our knees, we cannot take any more. The scientific evidence was put under the nose of Boris Johnson, and did he listen to it? He's delayed and he's delayed and he's delayed. And now we've experienced 100,000 deaths. So I really don't know how that man can look at himself. So a competent government would have supported the medics firsthand. What we also need now is more staff. We've got more staff leaving the profession than we do joining. Less staff means patient care is compromised. And as healthcare workers, that breaks our heart. When we're offering care, that is not the best we can offer. Just because the resources we're being provided by the government are too short, it breaks our heart. We take that home with us.
And it's not just also a question of numbers as well, is it? If Boris follows in the footsteps of Northern Ireland and Scotland and offered up the cash bonus, would that also help boost morale, do you think?
Short term, possibly, but it won't address the issues of the NHS. It won't address the 100,000 vacancies we have in the NHS, 45,000 nursing vacancies. That won't address the long-term impacts of short staffing we'll have. As I've mentioned, we've got more staff leaving the profession than we do joining. We're not going to have the nursing to provide the care. A £500 one-off bonus is not going to address the huge depletion we have in staff.
And long-term, let's look at the long-term then, Matt. I mean, are there long-term plans in place to help staff after the pandemic, on a personal level, dealing with mental and physical issues?
From each other, from our colleagues, from when we go to work, there is a lot of support we provide to each other. It's all well and good, and it comes from a very good place, but we're not able to provide that professional support to address the real issues. Long term, I saw a minister in the House of Commons that refused to work cross-party to address the mental health support and the issues that's currently being experienced within the NHS. Am I optimistic there's going to be long-term plans? Not particularly. And if there are plans, we need to be informed of them, and we need to know how to access them.
Indeed. Matt Tacey, thank you very much indeed for joining us.
Thank you.
Still to come this hour.